Imagine this: you're thinking about getting a Medusa piercing, but you're worried about the pain, the risk of infection, and how it might affect your teeth and gums. The piercing may look awesome, but what if you end up with a scar or an infection? What if it damages your gums? These are real concerns, and today, we're tackling all of them head-on, so you can make an informed decision about whether this piercing is right for you. What is a Medusa piercing? A Medusa piercing places a small stud right above the center of your upper lip, in that little groove under your nose. It's often called a Cupid's bow piercing. It's eye-catching, adds a bold edge to your look, and is growing in popularity. But it's important to know exactly what you're signing up for before you head to the piercing studio. How it works during the piercing process: the piercer marks the exact spot, disinfects the area, and then uses a sterile needle to create the hole. They'll insert a long labret stud initially, which can be switched out for a smaller one after healing. What does it feel like? Is it painful? Let's be honest, any piercing comes with a little discomfort. The Medusa piercing goes through dense, collagen-filled tissue, so you're likely to feel a quick, sharp pinch. But don't worry, the pain is brief, and most people say it's not as bad as they expected. It's over in seconds, and because your piercer uses a professional, sharp needle, it's a clean and quick process. Healing process: what to expect. The healing phase involves a little swelling, maybe some bruising, and possibly a bit of crust around the jewelry. You'll need to keep it clean and avoid touching it unnecessarily. Most people find the pain is manageable with over-the-counter pain relievers or even small pieces of ice. Your piercer will swap your long stud for a smaller one in about 2 weeks, once the swelling goes down. This helps protect your teeth and gums from damage caused by a longer bar rubbing against them. Essential aftercare tips: taking care of your Medusa piercing is crucial to prevent complications. Here's a simple guide. Hand washing: always wash your hands before touching the piercing. This reduces the chance of introducing bacteria that could lead to infection. Cleaning: use a sterile saline solution to gently clean the outside of the piercing. For the inside of your mouth, opt for an alcohol-free mouthwash to avoid irritation. Avoid food complications: eating can be tricky, especially right after getting pierced. Take small bites, avoid spicy or acidic foods, and stick to cold foods for the first few days to soothe the piercing. Potential risks and complications: oral piercings carry some unique risks. While many people heal without any issues, it's smart to be aware of what could go wrong. 1. Gum damage: the jewelry can rub against your gums, leading to recession or gum disease. If you feel any discomfort or notice changes, it's wise to visit your piercer or dentist for advice. 2. Enamel wear: playing with a piercing or tapping it against your teeth can wear down your enamel over time, causing possible dental issues. 3. Infection: signs include warmth, redness, discharge, and general discomfort around the area. If you think you have an infection, see a doctor immediately. Don't remove the jewelry until a professional examines it, as the hole could close up around trapped bacteria. 4. Allergic reactions: some people are sensitive to certain metals. If you have any concerns about metal allergies, ask for hypoallergenic jewelry options, like titanium. Choosing the right piercer: finding a reputable piercer is as important as the piercing itself. Look for a clean, well-organized studio. A professional piercer will always wash their hands and wear sterile gloves. Use a single-use needle from a sealed package, not a reused or sterilized needle. Provide clear aftercare instructions. Be sure to ask questions. Your piercer should make you feel comfortable, explaining the process and answering any questions. You can also request to see their portfolio, to get a sense of their experience and skill. Can a Medusa piercing affect your health? Studies suggest that oral piercings can sometimes cause complications, like gum disease or tooth damage. This piercing requires commitment to your oral hygiene routine, such as brushing after meals and using mouthwash. A 2020 study found that over 70% of people with oral piercings didn't fully understand the long-term effects on their gums. Don't let that be you. Tips for the best Medusa piercing experience: stay prepared, Keep a travel toothbrush and mouthwash on hand, so you can keep the area clean throughout the day. New jewelry. When it's time to switch out the jewelry, consider investing in high-quality, hypoallergenic materials. They may be a bit more expensive, but are less likely to cause irritation or an allergic reaction. Avoid habits that could cause issues. Resist the urge to play with your piercing. Tapping it against your teeth or using it as a chew toy can lead to dental damage over time. Summary: weighing the pros and cons. A Medusa piercing can be a great way to express yourself, but it's essential to weigh the pros and cons. Consider the maintenance, the possibility of discomfort, and the commitment to long-term oral health. If you're willing to take the necessary steps to care for your piercing, you can enjoy it without the worry of complications. The Medusa piercing makes a bold statement, but remember, it requires thoughtful care and hygiene. Be informed, stay prepared, and if you decide to go for it, enjoy your new look with confidence.